Fantastic. Right, everyone's starting to join now, Catherine. So everyone's coming in. Massive
Okay.
welcome.
Just let me know when we've got everybody and we'll make a start.
Excellent. I think we give everyone one more minute and then we
Yeah.
can get going. This
Great.
very exciting launch of our brand new programme. We're all set, Catherine?
Yeah, lovely. Well, thank you for joining us today. I'm sure at the end of a very busy day for you all, seeing that bell going at 3 o'clock, but really appreciate you taking the time out to join us today on the launch of a very exciting new apprenticeship standard for us. Just bear with me one sec, because there we go. So LMP, we are LMP Group, and we are made up of a number of arms of our business. So we're the LMP Education training provider. We've got LMP Action, which is our community interest group, and our apprenticeship training agency, Inspire ATA. So those are the three companies that make up the LMP Group. So we're focused on education and social impact. We deliver apprenticeship training to more than 500 organisations now nationwide. And specialise in the school area. We deliver AEBs, that's adult education budget training, and we incorporate all our apprenticeship recruitment strategies with that as well. So LMP embraces and represents 4 core values that are really, really important to us and are behind everything we do and how we work. So that's to be inspiring, to ensure equality, have compassion, and to take action. And that have compassion is one that really resonates with this standard as well. We employ more than 100 staff and more than 250 apprentices ourselves through our Inspire ATA agency. And we've also recruited more than 1,000 apprentices into our partner organisations over the last 3 years. We've been operating for 19 years and we've been a training provider for 10 years. So we've got lots of experience within the sector. So we're here today to launch our school staff and community wellbeing champion level 3 standard. So on the apprenticeship standard list, this is known as the community health and wellbeing worker, just for any of you that may have decided to look it up. That's what you'll find it listed under. But we've made the decision and working with our partners and in the school sector to call it our school staff and community wellbeing champion to make sure we're reflecting what you need in the communities and in your schools. The mental health and wellbeing staff in education settings has always been important, but it's now more important than ever in the context of the pandemic and moving towards recovery. That was a statement from Nadeem Zahawi, the Secretary of State for Education in November 2021. It's quite apt that this week is National Mental Health Awareness Week, and it's something that we've been promoting and celebrating all week. And it's really important that it's something that we know has affected, they call the COVID generation within schools, to make sure that mental health is something that's addressed, but alongside that, the well-being of the staff who have to also support those young people. So this apprenticeship, who's it for? What's it for? So that when we looked at this course, and we're always working with our partners to look at new standards that we can deliver, it was in response really to the education charter. So that wellbeing champion must be in place in every school setting by 2024. We say must, they recommend, but it is something that Ofsted are reviewing the impact of those people who have already signed up for the charter. So it's something that they are looking at, and from 2024 that you must make sure that you've got a wellbeing champion signed up. In that, we've currently been speaking with the DfE, and they're encouraging schools who haven't signed the charter yet to do so, and they're actually promoting this course to those who have already signed the charter, because it's something, there's not a lot of these called apprenticeship standards out there at the moment, and it's something the DfE are really encouraging to help support that well-being. So the overview is to work in partnership with individuals and their communities to identify and address health and wellbeing needs and improve health inequalities. Bit of a mouthful there, but what does that really mean, and what's the standard for? So let's start by having a look who the course is for. So you might be on here thinking it's something that you've got to have this wellbeing champion. It's something that most schools want to have, but where do they sit within the structure? So it could be that they're in the intervention team. It could be someone in HR that supports the well-being of staff, because that's just as important as the well-being of the students. It could be the pastoral team, the attendance team, the safeguarding team. The person specification. So what are they really looking for? When they talk about this standard, they talk about good professional conduct, able to demonstrate and understand empathy, approachable and resilient. And this one here, not driven by results. I know as leaders and having a daughter going through GCSEs at the moment, results are so important, but the well-being of the staff that deliver that and the well-being of the students is just as important. And sometimes you might not get the result that's the desired outcome, but actually the well-being of that individual is then protected. So that's what we're looking at when we're looking for that course. The community aspect of it, we've had a lot of questions come through about, but who is the community? What community are we expected to work with? Your school is your community. And within that community of the school are the families of the children, there's the staff, and then there's the wider community. There's outreach services that you may use to support the young people. There might be mentoring services through services like the YMCA. You've got CAMS, we've got faith services that might go on that link through. There may be food banks. That can be a big part of the community that we have to look at for finding solutions to those problems to support that well-being and development. So the community is vast, but it starts with your school and the school community that's there. So let's just talk a little bit first about the apprenticeship, because it's easy to focus on what we call the standard, which is that champion. But there's so much more to an apprenticeship that just sits with that. And the myth of apprenticeships are for trades like bricklaying and construction has long gone. But there still seems to be this apprenticeship myth that it's just for people that are new entrants into the workplace, and it's not. It's about developing new skills, knowledge and behaviour to develop in a role. So what we're looking for within this, what we start with when we look at the apprenticeship and we work with the person that's put forward for this standard, is giving that careers information, advice and guidance, making sure that we're able to listen to what they've already been doing. Where do they see themselves going? What's the best way for them to learn? What are the pressures that they've got within their role within the schools and outside of school in home? And how we can take all of that information and find out everything about them to give them the best advice of how we move forward with this apprenticeship. And you've got here the wider curriculum as well. The wider curriculum for us is something that's really important. It's about personal development. It's about the well-being within the apprenticeship. But it's also about offering those wider opportunities that stretch for the individual. One of the things that we've introduced in our wider curriculum is something called our global curriculum. And we have speakers once a month that are available for all our apprentices to log on to. And we've had anything from an Olympic champion basketball player talking about what's motivated them, and anything then to do with money matters, and cost of living. There's a vast array of topics, including safeguarding. So there's always something there for everybody that they might find that actually they've just got a bit of an interest in that. And we're currently going to be offering some more courses around sort of the SEND side of things as well. So just some refresher stuff that's on there. The one here that people normally go, I don't need to do that, but the maths and English and what we refer to as functional skills. So we do look that when we take people on, that they have a certain level of maths and English so that we can support them with that development. If they haven't got the equivalents to the grade 4 or above within their GCSE maths and English, or it may have been, the A to C, then they are required to take a functional skills test within that. And we have specialists that will support them in the development of those skills and provide that support through to taking that test. If you have already got those qualifications, we are required, and it's really important that we look at developing that maths and English skills throughout the apprenticeship and how we're using those skills in their everyday workplace. And I'll give you some examples of that when we go on to talk about sort of what makes up and how we gather that evidence. We also have added value. So we have some CPD courses, online courses that are available for anyone taking this apprenticeship, and those CPD courses will be relevant to the standard that we're delivering. And there will also be some there that you might just think, actually, that's something I'd quite like to dip into, to explore a little bit more. And you'd work with the tutor to be able to see which ones best suit the needs of that apprentice. We also have a team that provide additional learner support. We deliver apprenticeships to a vast range of people, and we may have apprentices that have dyslexia, autism, dyscalculia, and we have a team that can provide the support needed to take those extra needs that they may have to ensure that they can access everything as they need to for this apprenticeship. So looking at what makes up this standard. So this is everything here, the topics that are covered. And we've tried to give you a bit of an indication there of how long it takes to complete this module. But of course, every learner is different. So what happens is when somebody starts the programme, we will look at the initial assessments. We do a skill scan to find out the background, what experience you've got in what areas. And it may be that some of these modules will take less time and some of them will take more time. So the course is a 14-month practical period with 3 months on the end for what we call the endpoint assessment, which I'll go into in a lot more detail later on. So if we just take the first one, we always start with that personal and professional development. So taking responsibility for that personal and professional development in line with the organisational protocol. It's really important that that's done at the beginning, and it's something that runs throughout the programme. So when we put our curriculums together, we look at the scaffolding of the programme, building on that knowledge, looking at the sequence that we provide that training in so that it makes sense and it all starts slotting together. The next thing we look at is that legal and ethical framework. So are you operating in a legal and ethical way for the promotion and protection of public health and wellbeing? The first two modules that are there, we do deliver using task briefs, online webinars, and it may be that you don't always work when you're on the webinars or on the online workshops with your actual assigned tutor, because all our tutors have different specialisms. So we find it's really important to use the person with that specialism to deliver that training, and to help the learner prepare for that endpoint assessment. It's really, really important that they get used to listening to and working with different people. So that's something we try and encourage throughout the programme. We then look at the preventative approaches. So what are the preventative approaches that could be used to promote health and wellbeing of individuals? What are the wider determinants of the health and causes of ill health? It may be that you're in a particular area of the country where there's something that's quite prevalent. So there may be a higher use of food banks have increased, or something that there's a health and wellbeing outbreak. There might be particular mental health issues within certain age groups. And that's something that we try and address through a blended approach. So there will be sessions with your tutor on a one-to-one basis. There will be videos for the person on the apprenticeship to watch. There will be webinars, workshops. We make sure that that really has lots of different ways for individuals to learn, just taking into account, again, everybody's individual learning styles. Working in partnership, so this is something you will be doing on a day-to-day basis in schools, making sure that we're building local resilience and identifying the strengths and capacity in the local community to provide the best solutions to the individuals we're working with. Then we move to look on the behavioural science, so the study of human behaviour, why and when individuals engage in specific behaviours, looking at the impact of factors such as conscious thoughts, motivation, social influences, contextual effects, etc. So that's a 2 months. But it may be that if somebody hasn't looked at behavioural science before, but actually the working in partnership is really strong, we can adjust those about. And we will also work with the leaders within the organisation to look at the structure of the delivery model, because it may be that there's something within your particular setting that you'd like to be addressed first, and we can adjust the programme to meet the needs of the school. Then we look at that data management and referrals. So how do we manage referrals from a range of agencies and professionals through self-referral? So looking at all the different ways that that can take place, the importance of accuracy. So we talked earlier about the embedding of maths and English. Certainly, you know, the embedding of English and writing referrals, writing reports, if they're referring something maybe to CAMS, how that's, you know, constructed, etc. And then the final 3 months is the preparation for endpoint assessment. So the endpoint assessment is the part of the apprenticeship that's taken right at the end that confirms the development and understanding of everything that they've learned. And we're going to look at that later on to show you exactly what it is that takes place during that endpoint assessment. So just some quick key facts and stats there. The length of time is to say 14 months practical period. The endpoint assessment takes 3 months. And we have what we call off-the-job learning, which I'm going to talk to you about now. So off-the-job learning is learning that takes place during the apprenticeship hours that is not just the day-to-day work. So it can be anything from staff CPD's days. It might be something on your inset days. It might be LMP Education tutor visits, ongoing CPD linked to the apprenticeship through the modules that we talked about at the beginning, LMP Education training videos, and assignment writing and evidence gathering. And what we ask the apprentices to do is using a platform called Smart Assessor, which is our online e-portfolio system. We ask them to log all the off-the-job hours that they complete, and actually not just log in the hours and what they've done, but the impact of that, because we feel that it's really important for us and for yourselves to make sure that the apprentices are really getting something from the learning and that it's having an impact on them in their workplace. So that's something that the tutor will sit down with the employer and the learner at the beginning of the programme and during reviews, which happen every 12 weeks, to plan that off-the-job learning and to make sure that the learning that's taking place is really benefiting the individual and that they're really getting something out of it. So I want to talk to you about endpoint assessment. So I'm going to start with number 2 and then come to number 1, because the number 2 bit's quite straightforward and is quite common with endpoint assessments. So some of you may have apprentices already on the programmes doing the teaching assistant apprenticeship, so you'll be quite familiar with endpoint assessment. One of the ways that they test this is through a multiple choice test. It's 45 minutes, 30 questions, and the pass mark is 24 out of 30. We prepare individuals for that by carrying out mock endpoint assessments. So at various points during the programme, we make sure that we're giving the learners the opportunity to test the knowledge that they've developed so far. And we constantly build on that and go back and make sure that they still have that understanding, and that it's, more importantly, they're still being used in the workplace. So they would have had opportunity to carry out a mock endpoint assessment, and we make sure that they're at that pass mark before we put them in for the real endpoint assessment. It's really important to note as well that we work in partnership with the employer. So before we allow the apprentices to go to that endpoint assessment, we make sure that the employer, as well as us as the apprenticeship provider, are happy that that apprentice has the knowledge, skills and behaviours required to be at the level they need to pass this endpoint assessment. And at any point during the programme, if we find that maybe the apprentice isn't struggling or there's something else going on that's having an impact on their progress, we have that opportunity to meet with the learner and with the employer to sit down and discuss the progress that they're making, to iron out any issues and to make sure that they're making progress from their starting point. So all of you will be familiar with that education inspection framework. It's something that, you know, we're inspected by Ofsted as well. So we really measure throughout the programme how that they are making progress from the beginning. And with this standard, it's something that it's very hands-on as well. You've got to be able to take that knowledge and really apply it, because the demonstration of practice section of the endpoint assessment means that the apprentice must be able to demonstrate how they can take that knowledge and put it forward. So they complete what they call 3 stations. It's a bit of an unusual endpoint assessment, and they use what they call actors, which basically are endpoint assessors, but they call them actors. We use an endpoint assessment called NOCN, who are working with us and are very excited to be developing this standard to make sure that the endpoint assessment really reflects the activities that go on in school settings, so that when you get to that endpoint assessment, it's something that's really familiar to the apprentice. So they complete 3 of those stations, demonstrating that they can discuss an issue with a service user and support them to work through that issue. They have to make evidence-based decisions, use evidence-based tools and techniques, apply their underpinning knowledge to respond to situations as they arise, recognise when and how to refer and escalate, and collaborate with community organisations or groups. It's a bit of an extensive list there, but it's really important that the right person takes this apprenticeship. We don't want people to start the apprenticeship and it's not what they think it was going to be. And so we tried to give you an idea at the beginning about the types of individuals and the types of teams that they would come from within your settings. But having a look at what these 3 stations are really kind of helps hone that in. So we're going to have a look at those. So the first station scenario would involve reading an unseen case-based scenario. So it may be a scenario where you have had a learner that's gone into, that has joined you, that's gone into a foster care setting, and they've arrived at your school on the Monday, and that scenario is there in front of you. And then they would have to discuss the issue with the service user, the actor, co-producing an action plan to address the priorities, but making sure that they're able to work safely and within their scope of practice so that they're able to understand what's within that scope of their role and what they need to refer or to discuss with. And at the end, and this happens at the end of every station, they have to participate in a question and answer session with that endpoint assessor. It's a minimum of 2 questions, and that's 5 minutes. So they have 5 minutes to have a look at an unseen case-based scenario. They have to discuss it with that service user, who is the actor, and then look to co-produce that plan. Now, if they're in the right role and it's your wellbeing champion and it's in those areas that we've suggested at the beginning where they work, that would be something that they're used to doing all the time and would have had the training and support throughout the apprenticeship to put that together. On the second station, they would read a previously unseen scenario involving a community and preparing to present a proposed action plan to the endpoint assessor. So this may be that the individual within the school community has identified that they may need ELSA support. It may be that they need to be referred to, as I say, mental health support. I know here we have Mind Surrey, where I live, it's Mind Surrey that the individual might be referred to. They then have to look and present those actions to the endpoint assessor that they would take to deliver the outcomes in collaboration with the community and explaining their reasons. So it could be that they've got a young individual with high anxiety that's got school refusal. I don't know, maybe there might be an issue with alcoholism within the home. There could be lots of things within that scenario. Who would you liaise with within the community? Where does that collaboration need to happen to provide that support? And they need to be able to explain their reasons within 15 minutes, because we all know that these things happen really, really quickly, and often the response has to be very fast. And again, you've got that participating in the Q&A session with the endpoint assessor. Then you've got your station 3. Again, reading a previously unseen case-based scenario as somebody who's already partway through their course of action. So it could be that it's somebody that a colleague's been working with, they've put that plan together and now it's been passed over to you. You would need to be able to then, or the apprentice would then need to be able to discuss the issues and progress made with the service user. And again, it's really important that they understand that working safely within their scope of practice. So when we looked at those models earlier, that would take us back to the legal and ethical frameworks as well. So if you think about all those 3 scenarios, when we've looked at what the modules cover and what that training that will take place during the apprenticeship, you can see that from those stations, that preventative approaches, knowledge would be there, the working in partnership, that behavioural science, having that understanding of why things happen, what's the motivation for things, that social influence. And then the last section, we do that data management and referrals. All of those topics that have been covered have to be demonstrated in a very short space of time in those scenarios. Some of the legal and ethical frameworks would come up in the knowledge, skills and behaviours as well. So it's tested in a variety of ways, but it is really clear that the scenarios that are in the end for the endpoint assessment are really testing the milestones that we've been working towards throughout that apprenticeship. So what we're looking at with this apprenticeship, to recap, is that we're looking for people that are working as wellbeing champions within the intervention team, within the safeguarding team, within HR, that are providing that wellbeing and support with the community, which is the school and the wider community, and looking to develop those milestones and those skills needed to be able to deliver a really strong service to your end user, that whether that be a staff member who needs that wellbeing and support, or whether it's one of your students that needs that wellbeing and support, and their families. If you've got anyone in mind in your school that you think would be suitable for this apprenticeship, we, in line with the DfE guidance, recommend that maybe the head teacher or can nominate at least one person from each of your schools to join this cohort. So this is our first cohort. We've got a fantastic tutor whose background is within, they've had involvement with CAMS, they've worked as a TA, they're currently delivering training in an alternative education setting, they've worked with CAMS, they've worked in a community project, so have got all the skills and knowledge to provide your apprentices with that training that they need to make them an outstanding wellbeing champion within your organisation. So a link will be dropped into the chat, and you can see there at the bottom, all we need is the name of your school, your proposed wellbeing champion's full name, their current job role, their mobile number, their email address. We do also require that each of our apprentices has a mentor within the organisation, and somebody that can support them with their apprenticeship work as it's going through, and can just offer that sort of mentoring and that support. So somebody a little bit senior to them. It doesn't have to be their line manager. Sometimes it's better if it's not, they feel more comfortable asking for support. The mentor's email address, the school number, and the head teacher's name. It's as simple as that. Then one of the team would be, or either your account manager or just one of the team at LMP would be in touch to arrange an onboarding call. And we carry out a skill scan where we actually look at the skills needed for the apprenticeship, just so that we can see what prior knowledge is there, what do they know already, what do we need to focus on. As you can imagine, we have to go through sort of the standard documents that we need to be able to obtain that funding. And your account manager would guide you through the whole process from beginning to end. Once we have that and we're confident that you're eligible and that we can support your apprentice, you will be then introduced to the tutor, who will carry out an onboarding session where they take all the information that we've gathered and sit down and do a planning meeting with the employer. And it can be their mentor and the learner, the apprentice, and make sure that we've got all of the milestones in the order relevant to them. We're taking into account whether they need functional skills, is there an additional need there, and really bespoke that programme so that by the end of it, they come out with a really solid apprenticeship and an outstanding wellbeing champion for you. I can see there are some questions in the chat, so I'm happy to take those from you as well. I think, Amber, you're going to lead the Q&A, I believe.
Yes, good afternoon, everyone. My name's Amber. I'm one of the sales managers here at LMP Education. We've got a great panel with us today who are experts in either the delivery of this programme or helping you with all the onboarding questions that you may have. We've had some really, really good questions throughout the webinar. So there's one here that's quite a good question, which says that I'm ahead of year in a secondary school. I'm looking to do this apprenticeship. However, it's mainly intervention or pastoral teams that are being mentioned as being good candidates. Could I still be eligible as middle management? So I don't know whether you want to answer that one, Catherine, and then we can go through the panel.
Yeah, I think with heads of year, and I think this is obviously where we look at this standard, it's for primary and secondary. So within a secondary school, certainly where you're looking at that head of year, if you feel from what you've heard today that you're able to provide the evidence and carry out, if you look at that endpoint assessment that we talked about, they're the sort of things that you would be doing within your role, then absolutely we can look at that. When we look at those functions at the beginning, yes, they are individual departments that may be within the business, but certainly, you know, heads of year, you might have deputy heads of year that are really feeding into that. And as long as when we do the skill scan, we can see that you are able to meet the needs of the apprenticeship, because we do have to make sure you can get through that endpoint assessment, then absolutely. And I know, working with a fantastic head of year at my daughter's school, that they absolutely could do this standard.
Perfect, thanks, Catherine. And what if somebody was working in, say, a university setting where they were kind of for student support along those lines? Would that be suitable?
Yeah, I think that's something we could probably, happy to have a separate call with you to see and just to discuss. I think it's about having those individual conversations and discussing what that role that you're in includes and how that role within the university can meet the criteria with the apprenticeship. But again, if from what you've heard today, that's your role and that's what you do, then certainly we can have a look at that and have that onboarding conversation with you and get that skill scan out to you.
Thanks, Catherine. Another one of the questions that we had was what is the onboarding process like and the enrolment process? So I'm happy to answer this one.
Yeah.
And basically what will happen is once you fill in this information that we've sent over and we have all your details, what we'll do is we'll give you a call and we'll go through the enrolment process where we would take your certificates for your GCSE Maths and English, where we need to see evidence of that at C grade or equivalent, which could be functional skills level 2. If you are unsure whether you've got your certificates, you can get copies of those if perhaps you've lost them, but we can support you in achieving functional skills if you need alongside your programme, but it is preferable that you have exemption in one or both of those. So what we would then do is we would go through the skills scan, as Catherine mentioned, where we'll look at prior knowledge against the standard and see where you're currently at with the knowledge, skills and behaviours in terms of the evidence in the programme. Once you've completed that, we'll then get in touch with a tutor and we'll schedule an onboarding call where you'll go through the elements of the programme and ultimately start your learning. So we'll go through that process with you. It's a very easy process. It's all done online and it should be streamlined from start to finish. So that was a really good question. I've just had another one come through. I don't know if anybody else on the panel is on and you want to come on camera to answer, but we've got a family worker from a maintained nursery school. Would that be suitable? Because obviously the children are much younger. So is this targeted at that age group too?
Yeah, it's not particularly targeted for the DFE. We're targeting more at supporting colleagues. So as long as the particular apprentice was supporting fellow colleagues and they were they'll be supporting the community as well, the family members, the students, then yes, as long as they feel that they can meet the needs that we've mentioned and they're able to fulfill that evidence and make those referrals within that, then yeah, they should be fine to join also.
Perfect, thanks Ashla. Another topic that we talked about were cohort delivery. So just to mention on that, I know that there's a few people on the call who work within our multi-academy trusts, and it's just to mention that we can put on cohorts for your trusts or school exclusively. And this would really bode well with your off-the-job training. So one thing that we've discussed as part of this programme is introducing wellbeing networks within your schools or within your academy trusts. And that could be a member of staff from multiple sites at the trust, and you all get together and meet to do with wellbeing. You're discussing the topics of your apprenticeship, things like that. And they'd be really great ways to cover the off-the-job training that we discuss, which is a mandatory part of this course. So wellbeing networks are very much encouraged, and we can obviously put on exclusive cohorts for your trust. We'd probably be looking at a minimum of 20 to 30 learners per cohort. And that's something that you could discuss with your account manager before you enrol onto the programme. So just going back to the chat, I've got another question here, and they're very much to do around with eligibility to do with roles held within the schools. So I've got one here that says, can a teaching assistant in an SEN school apply? And is it an online course? And is there some face-to-face learning involved? I think maybe Ashva, you're probably best suited to answer this one.
Yes, it is an online blended course, so you'll get something similar to what we're doing now as a Teams meeting. So every 4 to 5 weeks, you'll have a meeting with your tutor and you'll have a session, and then there'll be assignments and tasks set from there. For the actual role itself, if the SEN TA has access to other roles within their job role, then yes, they should be able to apply. Because I know that you, as an SEN TA, if you're mainly classroom based and not taking more of a say a safeguarding sort of approach, or if you've not got access to those meetings where you can discuss referrals, or if you're not in a role where you're having somebody approach you in a to have some pastoral care, that it might be a little bit of a difficulty fulfilling the course requirements. So it would need to have a discussion about what your actual role is and what your day-to-day duties are.
Perfect, thank you. And Catherine, what are some of the hottest topics involved with this programme? I know that some of them mention like online safety and things like that. What are the kind of things we will be seeing during this programme if someone were to enrol?
Yeah, I think it's again going back to those milestone synopses. So it's, you know, understanding who the referral agencies are, the best way to refer to them, looking at preventative approaches as well. So we're going to be having resources available to the apprentices around things like mental health, maybe eating disorders, you know, looking at, as I said, food banks seems to be something that in certain areas that's been really prevalent that people are having to refer young people to. And then also looking at the mental health of staff within the organisation as well. So providing the apprentice with some guidance, short video pieces that they can use to refer to look at how they best can support individuals.
Amazing. This is a really good question that's just come in, and they've mentioned that they don't do any referrals within their roles. Would that affect their ability to gather evidence?
As you can see from the milestones, data management and referrals, it is about managing referrals from agencies, professionals, and through self-referral. And you can see from the endpoint assessment and the scenarios that are there that that's a huge part of what they'd have to demonstrate. So again, we'd have to really have a conversation about what that role is, but there is a whole section, I think Ashley, you can pick up on this as well, but on referrals within the apprenticeship.
Yeah, that's a really good point. And I think as well, what we've seen in the past is that for people to achieve certain qualifications and programmes, it's often a case of having a conversation with line managers just to say, is there any opportunity for me to complete this as part of my role, and to give me the opportunity to gather this evidence? So there could be a conversation to be had there, maybe.
Yeah, and I think on this, but I think on this standard in particular, it really is about, you know, it's that community health and wellbeing. That's the focus of the apprenticeship. So it does need to be quite a sizable amount of the individual's role that they're carrying out.
Great, thanks, Catherine. The other question that I've just had come through was about, is it mainly to work is it primarily based to work alongside colleague and they're a Key Stage 1 teacher? So I'm guessing this is about weighing up how much interaction it is between colleague support and learner support.
Yeah, I think all of these questions really come back to the same thing about having those individual conversations about your roles, because yes, you might be a teacher, but I know often some teachers have different and additional responsibilities where they can be the person for that key stage that maybe is the, you know, the wellbeing lead for that, and it does all the referrals and picks all that up. Certainly thinking back to sort of, you know, my experience of primary education with children, there were set people at the school who were teachers, but they were the SEN lead as well, and they were the person that sort of all dealt with the mental health lead and stuff like that. So it would be about speaking to you all as your individual roles, completing that skill scan, but we have to make sure that you can meet that endpoint assessment criteria.
Amazing. I guess that relates to the next question really, and you know, this person's mentioned that they work in a small school, and they're mainly classroom based. They only have 7 members of staff in total, so I guess that relates to what you just said in terms of somebody being that main point of contact for the wellbeing piece. So I guess that if there's any leeway there, it would be in terms of them having to be that go-to person.
Yeah, again, it just comes back to making sure that we can provide that evidence and that you can go into that endpoint assessment having done those things in your role. So when you look at those scenarios, they were there. It's not just about being able to do the scenarios for the sake of the endpoint assessment. It's about demonstrating that those are things that you're doing in your day-to-day role.
Perfect. I'm guessing we're kind of coming to the end of our Q&A now, guys. So if you do have any more questions, please do pop them in. But one that's just come through mentioned that they are the health and wellbeing officer for the staff, but not the students.
Yeah.
And you know, I'm guessing that's
absolutely
just,
fine.
Yeah, perfect. And that's it really from questions. We've had lots of good questions that have all been answered today. So I'm guessing I'll just pass back over to you, Catherine.
Yeah, so again, if you've got an account manager, they will be in touch with you. If not, if you've got any questions and you want to ask, if you just drop either into this chat afterwards or email info@lmpeducation.org, one of us will pick that up and come back to you. It's a really exciting time. It's a great apprenticeship standard, and we want to work with you to be able to get those wellbeing champions in place. So looking forward to having as many as possible on board. Okay, thank you ever so much. We will be able to share the presentation as well, and your account managers will be in touch with you.
Excellent. Thank you very much, Catherine. Have a great day, everyone.
Okay, bye.